No problem. So on behalf of the team at Healthwatch Sandwell, welcome to this public meeting. It's one of our regular insight meetings where we bring together some of the key people working in health and social care and give them the opportunity to tell us their activities and also to answer your questions. And today we're delighted to be joined by a team from the Midlands Metropolitan University Hospital and their plans for the opening of the new hospital. Before we do that, the team at Healthwatch are just going to give a little update on some of the activities they've been doing over the last few months. Throughout this meeting, we want to hear from you. So if you've got something you want to say, a question you want to put, please indicate. There's also the chat function that hopefully everyone's kind of familiar with. There's a little icon at the bottom of your screen. If you press that, you can chat on text to everyone on the call as well. Just so that we avoid background noise, if you're not talking at the moment, can I just ask that people press the mute, which turns their microphone off, which just means there's less background distortion on the call. And the other thing I just need to say is that we are recording this session because ultimately we'll put it on our website so other people can participate. And finally, particularly when Rachel's giving her presentation, perhaps if we allow her to finish what she's saying and we do questions at the end. But if you've got a burning question, put it in the chat function and then make sure we remember don't lose it at the end.
Excuse me, where's that on this computer?
Pardon?
Where is it on the computer? I've just got 3 dashes and an O and an arrow.
Okay, there's normally an icon that says chat, but it depends how your computer's set up. Now, before we move on to the Healthwatch update, clearly we're focusing on the Midlands Metropolitan Hospital today, but clearly the big, massive thing that's affected all our lives over the last year has been COVID. We've lost friends, we've all suffered in different ways, but there is some light dawning now with the slow release of lockdown and the vaccination programme. And I know all colleagues across health and social care in Sandwell have worked amazingly hard, GPs, public health, but particularly as well volunteers on the vaccination programme. So I just wanted, and I'm sure you all agree with this, just to pay tribute to the wonderful team of professionals and volunteers we've got, faith leaders, community leaders that are all helping make the vaccine happen. So on behalf of them, a big thank you. And thanks Steve, I can see you clapping there, that's lovely to see. So without further ado, I'll hand over to staff members that you all know, who's going to give you a little update on some of the Healthwatch activities.
Hello everybody, I just thought I'd start giving you some a glance of things we've been getting up to in the last 3 months. On the screen is some information there. For example, during this time we've spoken to around 629 residents of Sandwell. We've collected from them 49 case studies. This is issues that they've had with services which we will take up as part of our work planning in the future. And also we've actually targeted people to other services, 29 people we've signposted. That's directly so that they don't get passed to other organisations to the exact service they need. We've also posted 178 pieces of information and support on our social media sites, and our website was visited by 8,174 visitors in the 3-month period. And also our 3 projects that we're just finishing at the moment, we had 668 people support us with those, either using surveys or taking part in a focus group or a one-to-one interview. And that's just a bit of a flavour of the figures we have.
Okay, thanks Ian. That's great. Can everybody hear me?
Yes.
Yeah, oh, that's great. I didn't know if I was still on mute. The project, just to give you some feedback on access to mental health and wellbeing services in Sandwell during COVID, our aim was to find out how people's mental health had been affected during the pandemic, what coping mechanisms they'd utilised, and what their experiences had been of accessing mental health and wellbeing services in Sandwell. We aimed the project at the general population, so it was those who'd had mental health difficulties before COVID and perhaps during, and for those who had acquired a mental health difficulty during COVID. As Ian's alluded to, our methods of engagement were an online survey, telephone survey, and telephone interviews and focus groups, and some of the people on the call today have taken part in that, and I want to thank you for giving your experiences to us at Healthwatch. We had specific focus groups with the deaf and hard of hearing community, our young people who were part of our youth Healthwatch, and they gave us an amazing insight to what life was like for them during COVID, and also adult carers. Specifically, we heard from adult carers who care for people with learning disabilities as well as those with dementia. Our report's been approved and will be sent out to our stakeholders for comments, and then it'll be published and you'll get to see all the details of it. But just briefly, there were a total of 95 respondents to the different methods, so that was great. And our findings were not really that surprising, and I'm sure some of you on the call will identify with it, and you'll see the slide that Ian's just put up. But there was high levels of anxiety, depression, struggling and not sleeping. 17% of the respondents, which was the listed things as other, they listed things like feeling isolated, a lack of social contact, a loss of confidence, a great sense of fear of catching the virus and fears for their future and their family's future, and stress, which related to finances, loss of jobs, family dynamics, being in the house together when they're normally out and about doing their different things. So there were family dynamic issues, and bereavement, as John said earlier. We've lost quite a lot of people and close family and friends. People identified the organisation that they'd access for mental health support during COVID. They were given a long list to choose from, as well as others. So people like Sandwell Advocacy, Crunch, Sandwell Murray Hall Trust, amongst others. But the ones that were identified are in the second graph, where people gained most of their support from, which was the Sandwell Deaf Community Association, Young Carers, Black Country Women's Aid, Sandwell Council. It wasn't specified, but when some people, they talked about accessing the public health website, the Recovery College, which is part of the Black Country, the newly merged Black Country Mental Health Trust, and others. The others were places of worship, Asian mental health group that meet in Albury Library, amongst others, as well as different websites. Their coping mechanisms that they listed was mainly about getting out and about, enjoying green spaces to maintain their mental well-being, and keeping in touch with family. And some people have learned how to use digital, like what we're doing today, and more using their phone more. And some of them talked about developing new hobbies and revisiting old hobbies. I think they all agreed, the participants, that the future for mental health services, that the demand would be increased, and there was concern expressed about how services in the voluntary sector as well as the statutory sector would cope, because it might be quite overwhelming. We've made some recommendations, and I'm not going to go through all of them because they will be in the report, but just to highlight, we've recommended bereavement support for the public to be readily available, and psychological support, especially for key workers. Nurses in ICU were identified and people were really concerned about them. To address the issue of loneliness and isolation, to perhaps advertise more social prescribing in Sandwell. And then the last recommendation, although there are others, was emotional support for new parents to be made available. Some people have given birth during lockdown and have been quite isolated, especially first-time parents. So that'll be out for publication in the next couple of weeks, and we'll perhaps take questions at the end of this session. Thank you.
Hi, Sophie here. For anyone who doesn't know, I'm a community outreach lead along with my colleague Melissa Elders, who is on annual leave today. I'm a bit perplexed because my slides only just come up with half of the things I was expecting to see, but I can, oh, there we are. Okay, so I shall just talk to it anyway. So yes, Melissa and I led on a project looking at people's experience of using digital technology in primary care services, particularly since COVID-19 has increased the use of digital services in primary care services, so the GPs and the pharmacies in particular, and people have had to adjust to that because of the safety measures put in place due to COVID-19. So we wanted to find out what people's experiences were of services and how they were adjusting to using digital technology, particularly things like the video consultations and using just phones for rather than face-to-face. So we sent out a survey as well, which was online, and we wanted to be sure, because we were looking at whether people could use digital technology, we wanted to be sure that we reached those that might not be able to use digital technology. So we sent out postal versions, and we worked with organisations throughout Sandwell to make sure those were distributed. Places like the Citizens Advice, Boots Pharmacy supported us as well, for example, and a lot of organisations supporting people. So we sent out over 1,800 postal and paper versions as well. So what we got back was a representation of those that could fit in online and those that couldn't. We took the time to put those in ourselves or other organisations that were supporting. We also spoke to people on the telephone as well. And then we held focus groups through some of the support organisations in Sandwell, for example, Sandwell Visually Impaired, Ideal for All, and Rights and Equality Sandwell for people of other ethnicities, particularly those who couldn't speak English. Our findings were that most people were adjusting to the reality, and we've all had that over the past year, that we've had to learn to get onto these video consultations, for example, and people accepted the changes that were necessary. Most people were satisfied with services as per the findings chart that I'm showing there. People still liked face-to-face and letter and phone calls most, but they were neutral about video calls, which I wonder if we'd done that at another time, whether that would have been the same response. So we had 60% said they were neutral about video calls as consultation methods, but not that many people had used them. Most people had had phone consultations. In our focus groups, we had focus groups to look at those people that we thought might be more at risk of digital exclusion or have issues and challenges with using technology. So that was the over 65s, long-term conditions, sensory disabilities, learning disabilities and autism, and minority ethnicities for English not first language in particular. We also were looking at digital poverty, so those that don't have the equipment, the skills, or the data. So there's quite a lot of areas covered in there. We had 57 people we spoke to within the focus groups, and that was supported by the organisations I mentioned, plus others. What we found there, the main issues we found was around communication. The broad brushing issue is communication, either that people can't use technology due to reduced abilities such as sensory impairment or deaf. It's not that they can't, it's just harder, and support is needed and adjustments are needed. And people with language barriers struggle too, that if an interpreter service is available, that's great, and an online one, but there's room for improvement across all of the communication methods, including for people with learning disabilities too. So within our report, we have recommended that all accessible communication formats are reviewed, is one of our recommendations. Sandwell's known to have recognised to have a low level of digital skills, and there's about 30% of people do not own any digital technology. We found, particularly with the minority ethnicities through Rights and Equality Sandwell, that a lot of people just had a basic phone, not a smartphone, and again, language was the barrier to that, and there was a correlation between the two. So within our recommendations, we've suggested that person-centred services are key, and that those who may struggle to access digital technology for various reasons should reflect on their records and identify what their actual personal needs are. Because I was very struck by how many people, amazingly, that are blind or visually impaired, for example, do get on and use technology, and I think there's quite a few here today. So it's not everybody, but everyone's individual. So it's saying, talk to the individuals, make sure the reasonable adjustments are in place. And Healthwatch are offering to work with the primary care networks. We were going to on this project, but unfortunately due to COVID, that was, the front-face delivery, they had to prioritise that. We heard very good feedback about people's experiences, and we'd now like to work with the primary care networks at looking at improving the patient experience. Okay, any questions on that? No.
Stephen Moss.
Hi, Steve. Yeah.
Hi. At our surgery, we were using patient access.
Yeah.
Which was not brilliant, but at least it worked. And suddenly the plug was pulled on it. Do you know anything about that?
I'm afraid I don't. That's Cape Hill you're at, isn't it, Steve?
That's right, yes.
Yeah. No, I'm afraid I don't. But if you like, we can sort of pick that up after, have a communication and find out what your issues were and whether we can do anything about it.
Okay. Thank you. Thank you very much.
This is a piece of work we've taken on. Our board agreed to make some funding available to support local groups to help improve wellbeing in their communities. We selected 4 groups to do this, and the first one, the 4 Community Trust Kit, explains a bit there about what they propose to do. They're involving young people in producing a video showing how what young people think about health and social care services in Sandwell. The Life in Community CIC is based in Tipton, and they're looking at targeting people who have been impacted by the pandemic, who maybe would not have considered themselves as suffering with low-level mental health. And so they're going to do some work with those people and find out their experiences. The West Bromwich Dartmouth Cricket Club, this is a project aimed at mainly elderly and retired people in West Bromwich who come from ethnic diverse communities. They're going to develop a small area of land for flowers and plants and a seating area so that everybody in the local community can benefit from that, and also it will improve the health and well-being of the people looking after it. And finally, the New Baby Network CIC, they're offering some workshops to families focusing on developing skills that they can use in daily life to help improve well-being. And that's the 4 projects we've selected this year to fund, and we hope coming from that we'll have some work that we can share with you. Thank you.
Let's go now. This computer actually is from Skips. It's on loan at the moment. They're trying to get me one, you know, that I can keep. This one's only on loan for another 2 months because I belong to the Residents Association, and that belongs to Skips as well. So that's the reason why I've got this today.
Okay, thank you very much for that, Tat. With our Youth Health Watch, it's continuing to develop itself. There's not much update at the moment because obviously all the young people are on school holidays for Easter. But when they come back, we're arranging 2 training sessions, mental health training sessions for our volunteers in April, and that will develop them on and we can continue with the group from there. And that's a brief update on the Youth Health Watch.
Thank you, Ian, Anita and Sophie for those updates. Before we move on to Rachel, who's our star for this morning, is there any questions on any of that haven't been covered? Okay, without further ado then, I hope she's on the call. I think she is. I'm going to hand over to Rachel Barlow, who's the Director of System Transformation for the Hospital Trust. And while if anyone's driven past the area, let's see the buildings come on a pace. It's so much more than a building, and I think that's what Rachel really wants to convey to us this morning. So over to you, Rachel, and thank you for joining us.
No, thank you, John, for the invite. It's a pleasure to be here, and thank you for the presentations. They were really interesting. So I think already we've got some sort of synergies in terms of the communication presentation and how we work differently, and certainly the youth volunteers. So maybe we'll pick that up in discussion later. So yeah, my name's Rachel. I work at the Trust. I've been there for 10 years. My background's as a nurse, and I was previously Chief Operating Officer, but I was given the wonderful job of getting the hospital open just about a year ago. So some people might recognise me from old. Now I think Ian's going to do a bit of a Boris and Prof Whitty act with me. So if we go on to the next slide, please. Ian. Great. So I'm going to take you through a little update. As John said, maybe if I go through the slides, and then what I'd really love to do today is to open up to discussion. I'll answer as many of your questions as I can. One thing that we're quite interested in talking to you as a group about is how we work together in the future. I think there's 2 elements to that: how we work before the hospital's built, and how we work together after the hospital's built to really optimise that. So to spend some time talking to you about that would be ideal for us today. But that's the things that we're going to cover quickly in the slide pack. So if we go to the next slide, please. So the building is coming on leaps and bounds. The outside doesn't change too much, but inside really is changing. So we have 800 staff inside the building today working on that, and by next month we'll have over 1,000 trade staff working in there. So it's a hive of activity. It's starting to look a bit more like a hospital than a construction site. So we can plug flow meters into the oxygen pipes now. We've put the first floors down and the final painting on the walls and some of our ED cubicles. So just to give you a little taster, it's starting to move towards looking like a hospital. So just to assure you we're on track. COVID has been a challenge for all of us, including the construction industry, and we have lost a little bit of time, but I must say Balfour BT, our construction company, have done remarkably well. The photos there, we've adapted the site, so the huge car park that you'll be able to use when we open currently is an extended welfare facility. So the 800 staff go in shifts to have their breaks and sit socially distanced. So we've cleverly used the space we have to make sure they're safe at work, and we've put extra hand wash stations in. So luckily we haven't caused 13 mile tailbacks, but again, the bottom of that, if you're a bit of a geek about construction, lets you know sort of that the Balfour BT have been busy. So next slide, please. So our model of care going forward, you'll have seen some of these slides before, but I thought it's worth just emphasising as background. So when Midland Met opens, and it's worth me emphasising, we are on track to open in 2022. We're going to be taking a paper through to our trust board probably in June, which will recommend an opening date. But what I can say to you now is that we're on track for a 2022 opening, so that's good. So Midland Met will be our single acute site, taking services including the EDs and the inpatient acute wards, cath labs, diagnostics, etc. into Midland Met. What will be retained at our current sites at Sandwell and City are treatment centres. So there's the Birmingham Treatment Centre that the public will be familiar with, and effectively we will create a treatment centre at Sandwell. So the treatment centres will take any planned care, so outpatients, scheduled diagnostics, and any procedures or operations that take up to 23 hours of treatment and recovery. At Sandwell, we also, as you know, will have an urgent care centre. In fact, that urgent care centre opens on site next week. So we get to establish that model of care before we decouple the A&E, and I think that's quite an advantage to us to embed that way of working and branding and access to urgent care, which is so important. We retain the eye centre on the City site, and then our community beds will be distributed still at City in the Sheldon block. We will be putting 3 community wards at Sandwell in the current acute ward block, and then we retain Alisos and Rowley Regis. So we're investing more in our community services as well as acute services going forward. We don't own all of the City site anymore. We lease it back as a peppercorn rent from Homes England, and we're working with them now just to review the master plans about how that site will be redeveloped. It's likely that it's going to be mixed commercial and housing. What we do have in our own plans for health is to invest in the development of BMEC, and we know that that will need expanding. So we're likely to look over the longer term at rebuilding that near the BTC and having a very sort of specific health campus and health focus on that side. If we go to the next slide, Ian, please. So a few things to emphasise from this. What are we building and why? We're building an acute hospital where we want to provide equity and care 7 days a week. That's a big focus in the NHS in terms of good clinical outcomes. So by putting our medical and nursing staff and our therapists onto one site, we are able to provide extras. So the consultants you see on a Monday, Tuesday, Wednesday, you'll have the same access and service to them over the weekend. So that's really important to us. There's ring-fence diagnostics. What that means is that the diagnostic kit, the radiology kit, the CT scans, the X-rays, MRI scanners in Midland Met are just for urgent patients and inpatients. So the GP work will go through the treatment centres. For patients therefore presenting into the emergency department and requiring an inpatient stay, it means that you will have much better access to diagnostics, so that we anticipate we'll make earlier decisions about your treatment and reduce length of stay, and certainly give earlier certainty to the diagnosis and treatment plan. So that's worth mentioning. And the other sort of opportunity for us in terms of the way the building's designed is something called ambulatory care. So that's same day emergency care. We have teams that will prevent your admission, but make sure that you're safely discharged home. At the moment, we're a bit landlocked in our current estate, so the new building really gives us the facilities, modern ones, to do that. So in terms of, next slide please. Oh, did I skip one too many? We were flicking back and forward then. Go back in quickly just to make sure I haven't, no, forward, sorry. That's it, clinical model. So again, points of emphasis from this is that we're only intending for patients to go to Midland Met if we can't care for them locally in the home, community, working primary care, social care and the third sector. We also are committing to our clinicians that although we're putting an additional site in actually by creating Midland Met, that we're not going to schedule them to move between the different hospitals and outpatients. We're going to have them working in the same place. So we're going to take travel time out and convert that into time to care for you if you're one of our patients. The building's really technically sort of sophisticated, so we'll be having robots delivering, not patients, don't worry, but anything that's not a patient, food, waste, pharmacy, real slick movement to make sure that the goods that we need to provide care are with our clinicians and patients at the right time. So that's a big logistics project we're doing. And then building on the communication presentation Sophie gave, the new ways of working virtually, otherwise, accelerated that. I think if we surveyed our clinicians last year, they wouldn't have been big fans of it, but we've had to adapt. So we're looking at really optimising that and make sure that's a great service and a satisfactory one. So that the audit results, the survey results were really good information. And the other thing we're creating Midland by putting our clinical teams all in one space is that the subspecialty opinions, so you might be under a respiratory doctor but might need to see a heart doctor, we'll have the teams all in the same place and we can get those sort of joint team opinions very, very quickly. Let's go on to the next slide, Ian. So over the summertime, in between the two surges of COVID, we did manage to get over 300 of our clinicians socially distanced into workshops where we could refresh and look at our clinical models. And this just is a summary of their focus. And I must admit, they found it really very motivating to have something other than COVID to concentrate on, because the drain on individuals, as you've said, is really significant. So we're going to be really concentrating on our pre-hospital care. So this isn't all about Midland Met at all. So we now have really sophisticated data where we think we can predict health needs. So when are you likely to fall? When are you likely to deteriorate in your diabetic pathway? So that intelligence we're using to review our care and look at how we could have earlier interventions on patients' pathways. It's a new piece of work and probably worth socialising with interested parties as we develop that. But effectively, that's preventing unnecessary hospital attendance and making sure we get your interventions with primary care and social care right in the community. Other points to note probably is at the end, we're looking at standardisation of pathways and how our wards work. And that's to enhance safety, but also the patient and visitor experience of the wards as well. So let's go on to the next slide, because I think I've covered quite a bit of that. That gives you a few facts and figures around the number of patients we're expecting through the urgent care centre, which will be open 7 days a week, 24/7 at Sandwell. And the, excuse me, the treatment centres, as I say, will deliver up to a 23-hour model of care to support sort of slightly extended day casework. Community, we're investing in beds, so the stroke rehab ward will remain at Sandwell, and we'll put 2 extra wards in there for intermediate care and rehabilitation. And we're wanting to concentrate on increasing the sort of patient pathways that step up into the community beds, so that we can give patients support in that environment and possibly avoid A&E. So a big concentration of frailty pathways and older people pathways in that space. We go to the next slide, Ian. That talks a little bit about my community model. Just before COVID, we started a pilot where if you get admitted through A&E at the moment to the acute assessment unit, you'll be seen by a consultant who's qualified in acute medicine. We've started taking that team out into the community now. So they have the ability to do blood tests and something called an echo, it's an ultrasound, where they can look at lungs, heart, tummy, and do some diagnostic tests in the community and make decisions on how to treat. So that pilot started with care homes during COVID. We were looking to try and keep patients in their care homes and treat them appropriately rather than bring them into hospital, which is a much better patient experience. And obviously during COVID, de-risked some of the older people presenting to A&Es, which obviously were very busy with COVID. So we're evaluating that. So we're taking, I suppose, the acute care outside of the walls of the hospital going forward, working closely with the GPs on that basis. The last point on that slide is our involvement with the third sector, which will remain vital, those partnerships, and we'll be working with them to look at how we adapt or optimise the benefits of a new estate. Let's go to the next slide, Ian. Staffing, we employ well over 6,500 staff now, because we've got a few GP surgeries that have joined us. Our staff, as I said, won't be travelling between sites. That's a small sentence, but a big commitment for us to schedule our staff effectively. And as I say, we're providing a 7-day service, 52 weeks a year for the essential areas. We're working closely with partners, so we'll be looking at making sure that we don't have the complications of 2 social care providers or 2 mental health providers and Midland Met confusing pathways. So we're already working with our colleagues in those organisations to make sure we're set up to work effectively, and there's space for them to work in our new environment and the treatment centres too. Let's go to the next slide. Changes for neighbours you might be interested in. Walsall are extending their ED and urgent care centre. So when we open Midland Met, our modelling shows a small catchment loss. So some patients will maybe choose to go to that ED rather than ours. So that's on track to open in the late summer of 2022. Otherwise, we're not expecting any sort of changes for our neighbouring organisations that provide acute care. Next slide. So this is a slide about, it's more than just a hospital. I could go on for ages about this. So effectively, the new hospital is a £500 million investment in a very deprived area. So success for us is, of course, about healthcare, but it is also about the regeneration impact that this investment can give the area. We're involved with a partnership with Birmingham City Council, Sandwell Metropolitan Borough Council, the Combined Authority and the Canals and Rivers Trust, where we're jointly working on a very specific written document of regeneration, which is about health, wealth, social economy, green space, etc. And I think that will be due to be published over the summer, but making sure we're joined up to regenerate. Delighted to announce that we were awarded just under £13 million from the Smethwick Towns Fund bid, which is part of Sandwell Council's regeneration bids. And effectively, this is Midland Met in this drawing here, with the M for Midland. And down the front, to the south of the green, we have planning permission to build there. And we will be building phase 1 of what we're calling the Midland Met Learning Campus. And that's a partnership which will definitely include Learning Works, Aston and Wolverhampton Universities, Sandwell College, we hope the Department of Work. And effectively the ethos of that building is about widening participation to learn and then to get into substantive jobs. So we're just starting that piece of work, and I think that could be a real game changer in terms of opportunity for our local population, not just related to working in health, but across all sectors. Phase 2 of that piece of work that we still need to raise money for, but support from the council and other stakeholders, is just to the right hand side of the M for Midland Met is a canal, and on the other side of the canal our intention is to raise funds to build a university campus on that site. There's real evidence that place-based learning converts 1 to successful qualification, but 2 to students then staying in jobs and gaining substantive employment in their local area. So that's an aspiration of ours. That would be the first university campus in Smethwick that we achieve. So some big regeneration ambitions there. And effectively we could create an environment where, with the local housing developments, that with schools being there, that you could be born in Midland Met, go to school locally, go through our learning campus for development support, and end up working in a local area. There's a real life cycle of learning. So we're really passionate about that. We also have a lot of outdoor space on site, as well as a fabulous winter garden. So we're wanting to work with the local population to look at how they'd like to use the space, either to run some businesses or voluntary groups and support groups yourselves as well, to use that space as a community area. That's definitely the feel that we're looking for. Nearly finished now, so let's go to the next slide. So I said we wanted to have a chat in conversation that obviously John will lead about creating sort of ways of working. We're looking at our patient engagement programme associated with this, and we're looking to create ambassador roles. I thought it worth mentioning here. And we're looking to also utilise the community champion network that's been created as part of COVID. Talking to Jane Salter-Scott around perhaps pursuing conversation about that. But the ideas for pre-opening and working with yourselves is looking at definitely testing our communication engagement products right. And you know, again, in that survey, there's all sorts of diversity we need to respect. So definitely we'd like assistance with that. We did close tours to the hospital during the surges. We're going to be reopening them shortly, but there's an opportunity to come on site and look around. We're just about to commission our wayfinding solution for the hospital, and we'd like to test that with the public before we go ahead and approve it. So there's a sort of up and coming piece of work that might be of interest to some. We're looking to have thematic engagement events. So where the builders sit for their lunch, we could use that in the late afternoon, evenings, that space to have people on site, or we could do something remote or a hybrid. But we would like to sort of have thematic conversations about outpatient experience, different pathways with the public. So again, your thoughts about that would be really appreciated. And really to be a conduit for information and sharing. Post-opening, we have a sort of 100-day snagging sort of opportunity where we're going to have to fine-tune things. So is there something to you know, for Healthwatch to be involved in going forward? And also we'll be looking at obviously peak visits and how we assess the quality of the environment and the pathways we're doing. So those are a few sort of suggestions to get this thinking going. So I don't know if you want to take the slides down and then we can have a chat, but thank you for listening.
Rachel, thank you very much. That's an awful lot of information that you in about 15 minutes, which is a sterling effort. In the chat, there's been a couple of questions. We have answered them, but just to confirm, I'll send the slides out to those of you that are registered, and we will also add them to our website, so they'll be available in two sources. So obviously there's some detail on the maps and things like that. I mean, just, you know, I've heard various versions of this presentation over the last few years, and every time I just get a sense of excitement. It's not hospital, there's so much more going on, and it actually, you know, in terms of employment opportunities, green space, fitness, well-being, it's great. And it's really nice the way you ended that, Rachel, by reaching out effectively and saying, you know, the citizens of Sandwell and West Birmingham, the potential patients, are actually the people that will help make this work, and you want their insight, you want their views, you want their support in getting the signage and wayfinding right, and so that's great. So it's a great offer, and I know Toby Lewis, Rachel and Richard Beacon, who's currently looking after the trust, have all made those offers over the years to Healthwatch and our wider partners. So let's hear some thoughts, reflections, questions, comments. You can put it in the chat or you can do it directly. Rachel, I think you've got your hand up.
Yeah. Hi, everybody. So I'm Rachel McPhee from Oscar Sandwell, and we're a third sector charity that support people with sickle cell and thalassemia. In the presentation, it was briefly mentioned about the sickle cell and thalassemia section. Could we, is there any way we could elaborate a little bit more on that? I know a lot of our clients are really eager to hear a bit more about what's happening there. Is it going to be slightly bigger than what we have currently? You know, I don't know if you can elaborate a little bit more on that.
Okay, yeah, sure.
Yeah, and also, sorry, I had a question from one of the moms. Her daughter currently uses the service. She, I'm not sure she's here today, but she did say one of her questions was the ward. Is there a specific ward for people with sickle cell and thalassemia, or is it going to be a joint ward or something like that? Is it going to be specific in the hospital ward, or is it going to be a joint one? Thank you.
Okay, thanks, Rachel.
Thanks, Rachel. Great name. So in terms of sickle cell and thalassemia, I said that Midland Met is for urgent care patients, and the planned care would take place. There are a couple of exceptions. So those exceptions are maternity, children's services, we will have some outpatients in there, and then sickle cell and thalassemia. So the entire service will be hosted in Midland Met. So it won't be decoupled in any way. That's a move in. It does have its own area. We can do an engagement session outside where we can go through the plans and talk to you is probably the best way to hook up. Happy to do that. And so I'll get your details from Ian and the team. So I suggest we pursue that. That would be part of our intention anyway, but since we've met now, let's just get on and do that.
Yeah.
In terms of beds, we haven't locked our bed location plan down yet. We're due to do that in April. So I'd rather answer the question, because I can then say, and this is the ward, but there will be an allocated area that we'd look to use, so we can make sure the skills are there from our multidisciplinary team to care for any inpatients that come in. The very immediate phase would still be through the acute assessment unit, which I think is appropriate, but we can go through site plans and stuff with you.
Okay.
That sounds like a firm offer of a separate session between Oscar and the hospital, so that's good. I know Steve's got his hand up, but before I take that one, there's a question in the chat. Will the hospital engage with residents living directly opposite the site?
Yes, definitely.
So I'm sure that's not quite the case, but Rachel, do you want to answer that?
Yeah, so our engagement plans, we've had to review quite radically how we're going to engage. I'm working on the assumption from a programme point of view, COVID's here for the lifetime of this project. We all recognise we're getting over that vaccination programme's going well, but I'd rather plan on that basis, and then if we can have big meetings on site, that's a bonus, but I do think we can use the car park. So the local residents are a cohort that effectively we need to communicate specifically with from our point of view. Part of that is what's happening in a great big building opposite them or in a local area, but I think the regeneration and the opportunities for the local population is key for us. This isn't just a hospital, and I think we need to engage the local population there's no point us building learning works and having people travel in and not get the impact for the very people that we're intending to. So we're going to start sort of a local residents group through Ruth Wilkin, our Director of Comms, and the team. So yeah, good idea. And
okay, thanks, Rachel. Did the person that asked that question want to come back at all on that particular point?
Yeah, I have to take any input.
Yeah, it's Delroy from Friends and Neighbours. Can you hear me, Rachel? Yes?
Yeah, who's that?
It's Delroy from Friends and Neighbours.
Hi, Delroy.
We're based in Smethwick. The reason why I asked that is, one, it affects me directly, because I do live directly opposite the hospital build.
Okay.
And two, the issues of parking around the area, because there's no information to local residents regarding highways. We've just been told we've had nothing at all. And the issue we have is parking restricted already in that area. And I know with the parking charges, with the parking at the hospital, will affect people parking around the area, same as the normal Dudley Road Hospital. So in effect, there's going to be a, let's call it a conflict of interest regarding the parking situation there.
Hopefully not. So definitely a focus on travel and parking would be helpful, as maybe one of the first things that we talk with you guys about.
Yeah,
yes, definitely.
and I think even though Delroy said, this is Mandy from Friends and Neighbours, even though Delroy said is the site exact opposite the hospital, I live a bit further up near Asda, and already we've got a problem with the parking.
Okay.
So even though it's a bit further up, me personally myself, I would park there and just walk down Raglan Road. I'm at the hospital.
Okay.
So the impact now of parking, I mean, it takes me half an hour to get out of my drive in the morning.
Really?
You know, so this needs to be discussed, I think, a bit further than just the immediate opposite, with other people a bit further up.
Yeah.
And last point, Rachel, did you say about the learning works?
Yeah.
Does that mean that the existing site at the moment on Unit Street, is that going to be vacated for them to move to the new on-site?
It will be. It's grown out of the accommodation isn't big enough now. So we're looking to reinvest and expand on the new learning campus site. So yeah, that will be vacated. We haven't worked through the timelines. We've only just got the money. The business case needs to be in with government, the full business case at the end of this calendar year. So we'd look to start building in 2022. So it might well open a little bit after Midland Met, not long though. But so you're talking within the next 2 years, we'll look to recreate that. But it's a good opportunity for us to think about what does learning works look like in the next 5 or 10 years, and make sure we keep scaling up that.
Yeah, because I have conversation with Lawrence, the manager there. The other thing is, if that building is then vacated, would it be sold to investment in a developer, or would it stay within the NHS sort of?
We haven't got any decisions about that at the moment, but I'll take the question keep you informed.
Thanks, Rachel. Thank you.
Okay, great. Thank you, both of you, for those questions. In all the years I've worked with hospitals, parking and impact on local streets and residents is often one of the key things. So clearly getting that engagement right will be key over the next year. And it sounds like Rachel's got that clearly logged. If we go to Steve next, and then I think IQ had a question as well. I think he had his hand up, but if we go to Steve first.
Okay, well, it's actually Jean who's going to ask the question. I'd just like to say, because we go to Cape Hill and we're members of Raglan Road Christian Church, that it's quite exciting to hear that the area is having redevelopment. And my own slight question is, what's PEAT?
Oh, sorry. So the P inspection effectively is an inspection regime we have of our environment. I'm going to have to wrap my brain. So it's looking at the environment. Is it clean? Is it well maintained? Is it good, good quality to provide care in? And we do those surveys with the public, or patient representatives, I think is.
Oh, that's fine. Thank you.
So,
Over to Jean.
Yeah. Could you say a bit more about the robots, please? Like, are patients going to be dealing with these robots or?
No. So the robots, you won't even see the robots. So in terms of Midland Met, there's different sort of segregations of travel. So effectively, the staff will be in an area where they travel around up and down stairs and lifts. And then with patients, obviously, and then there'll be a public. So we're going to split those. The other split is the robots. No one will see the robots other than the robots start their journey of the day down in one of the car park floors, but in a receipt and distribution area where our goods are delivered. They are effectively, they are probably, I suppose if you were to take a small Mini, they're probably about half the size and a bit taller than that. So they're square. It's like, it's not a robot with arms and faces. It's a vehicle. No, they do exist. Gene, they exist in other hospitals, but anyway, we're not having that. So effectively, it's like a little electronic vehicle. And in the beginning of the process, the goods will be prepared. So the robot receives the cardiology ward's medical devices for the day, or the respiratory ward's drugs. And effectively, it goes secretly behind the scenes into that ward. And there's a receipt and distribution area where we'll have a professional team, and their job is all about timeliness and safety, which is very different to how we work now. We have lots of different people working on a pathway, and there's quite a lot of efficiencies we can get. But we can... what we'll do is that we'll make sure that we start sort of getting some photos and videos out, because people will be intrigued, but they won't interfere with patients.
Okay, thank you.
Thanks.
I was just thinking, Rachel, of all those gritters which the public get involved in naming. I don't know whether that can be something you can do with your transport.
Maybe.
Yeah. Okay, is that okay, Jean, or do you want to come back on that one?
But I just had visions of, as a blind person, trying to talk to a robot.
No. Okay.
No.
That's not going to happen, is it? All right. If we go on to Q, had his hand up. So I don't know your name, but that's what you're logged in as. Are you there? Has he gone? He had his hand up a moment ago.
Yeah, sorry, I'm trying to get my mute on. Yeah, it's a couple of questions have been answered indirectly, but I'm a sickle cell person, adult, and a couple of the concerns I had. I know Rachel mentioned about a particular wards and stuff like that. I mean, over the years, I've been put into dementia wards, I've been put in lung wards and stuff like that. And it seems to be a lot of talk about for the children and not the adults getting treated, having a ward for themselves. So I just want to know, would Rachel have a meeting with other people with sickle cell with their concern with Oscar Sandwell or Oscar Birmingham? That was one question. Also, disability car parking, would they be a charge for people with blue badge like there are at City at the moment?
Okay, so if I take your first question on the wards,
Yeah.
so yeah, absolutely, we'll have a sort of holistic conversation around the patient group for sickle cell when we have some time out. In terms of the wards, it's probably just worth pointing out the ward design is very different to maybe what you've experienced at City or Sandwell. So 50% of, excuse me, the beds are in side rooms. So at the moment, of course, at City, we've got a huge long Victorian wards, haven't we? And very little side rooms for privacy. Sandwell, there's bays. But the wards themselves effectively are 50% side rooms with ensuite facilities. And then the bays that do exist on the wards are mainly 4-bedded bays. So again, a little bit more discreet and more spacious. The building is beautifully designed. The windows are huge. The light, that sort of therapeutic element of the architecture, again, is a different experience, which I can only imagine in cases like yours, I hope add a little bit of value to when you do have to come in. But effectively, there won't be a ward for sickle cell because our wards are 33 beds, but you'll be on the intention is you're on a ward where the skills are there to look after you, from our staff. But that the likelihood is that you'll be in single side rooms. I should think on those sort of pathways. So again, worth this as we do tours and videos orientating you to that. So does that answer that question for you?
It is. It's just that being with other people of various age with sickle cell, and and I've gone to visit them. They visit me, and especially in I think the Wolverhampton, is it Manor Hall? They've got side room, but they also have got on the walls information about sickle cell, how it affects and stuff like that. I haven't noticed that at any good hospital where I had a serious crisis at, and the fact that you're now saying that on the weekends we're going to have consultants rather than clinical staff, that is very, 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 very good news to hear, because that's what a lot of us that are worried about. So if I'm going to have a crisis, I try and have it during the week and not on the weekend.
No, you can't schedule that.
Well, I try to take the tramadol and gabapentin and morphine and to last me, so I don't go in on the weekend. Yeah. So I'm glad to hear about that. But I'm just really concerned that there isn't going to be a specific ward or a certain amount of allocation room like they do at the Manor at Wolverhampton.
We will allocate a zone where you've got skilled staff and the improved environment. As you say, the 7-day consultants will help. So we can go through the plans when we have a session or two over the next period. Your car parking charges, I am going to have to refresh my mind. So if I could come back through Ian with an answer to that, because I think the government policy is changing and I don't want to get it wrong. But if I could, please just come back to you, because it changes in year, I think. So if you don't mind, Delroy, if I get back through Ian with that question.
Will it? I mean, a system at City at the moment is diabolical. Even when you're dropping off a person with dementia or somebody who uses walking aid, and if you don't understand the signage, and you've got to go through the system, and you've got to step out the car, run inside, find somebody to say, look, I've made a wrong turn, and I've got this elderly person, and I'm just dropping them off, or I've got a blue badge. So is it going to be more clear cut when a new hospital opens?
Yeah, definitely, and we can go through a sort of walkthrough. Some of those sort of walkthroughs before we move are some of the things that I was sort of, I suppose, pointing out in the sort of how do we work together before the move. If people are interested, we can go and look at that and make sure that our actual how we're going to run that area for receipt and drop off might make sense to us, but does it make sense in terms of experience? So those are some of the walkthrough things that we want to do. Or drive-throughs.
And just one more, John. The issue, believe it or not, I'm actually hearing impaired. I had a massive brain tumour, so I've got no hearing whatsoever. So there's a lot of times that if I go to different hospitals or that, I have, even if I wear my hearing aids or stuff, you sort of explain to them beforehand, says, look, I'm hearing impaired, you've got to look at me so I can read. Some understand and then some don't understand. But the issue I have, because I know you says a lot of GPs are going to be on board for various is it treatment or allocated treatment and stuff like that. And even though you've got people with disability, whether they're elderly or whatever, you are still made to make the appointments yourself, go through appointment system, which doesn't seem to work, especially if if you're hearing impaired or you're visually impaired, where you've got to try and listen to what number do I press, or so forth. So I want to know how is the booking appointments are going to work? Is it still going to be where the doctors say they're going to book it, or they're going to say, well, you have to book it yourself, and then you take weeks or days to get through?
Okay, let's take that one then. Thank you for that.
So that's about the booking experience and process, and in general, and then definitely the experience for people who are deaf or have hearing impairment. That's your line of inquiry. So again, I'll take that to our team, and again, if I can get your contact details, Darryl, from Ian, that'd be helpful, around about the experience that you have and how that can inform, because that's not a Midland Met thing, that's a now thing, isn't it? So let's pick up the sort of experience of hearing impairment through our booking system now. So I'll make a commitment to join up with the right people to make sure we can look at that. We have a piece of work, so as to say, it's not all about Midland Met, looking at how the treatment centres will work going on over the spring and summer. Part of that is we're going to review scheduling, so making appointments. So scheduling of patients, our staff and our kit. And so that's the right place to look at the experience, and is there anything that we need to change. There isn't any fundamental changes we've got planned. So again, if you guys have got thoughts about that, happy to hear those, but clearly you're putting one out for us to look at already. So, but we want to do a good job. So happy to work on that. And one of the sort of focus sessions, the thematic sessions that we're intending to have over the period of this year is feedback on that, because we might as well design in the improvements all at once if we can do. So
Thanks for all those set of questions, really helpful. I mean, the commitment from the Met in the redesign of services around senior clinicians being on duty throughout the weekend is a massive improvement, and potentially, can really change how long people end up staying in hospital. That's very welcome. I also just keep hearing Rachel saying, and it's really welcome, around not just staff testing, and there'll be months of that, but patient and user testing, getting signage right, getting the walkthroughs right. And so we all need to make ourselves available, I guess, as far as we can, to support that, to make sure it works for us at the end. There's a question in the chat, Rachel, and it's to do with the apprenticeship scheme. When the building we started, did the apprenticeship scheme get reintroduced, and what was the take-up?
For the construction site?
Yes, I think that's what it's referring to, the build, yeah.
Yep, so there's a commitment for Balfour Beatty. They have sort of community goals within their contract. One of those is apprentices. There's others such as percentage of locally employed people or procurement through local companies. There's a whole host of, socially responsible ways of working. So the apprenticeship schemes over COVID all across the country were interrupted. They're restarting those now, and their commitment is really, in that space. It's very evident, and it's ours as well. So yeah, that's back on track now.
Right. And just a general question, Rachel, from me actually. What kind of percentage of local people are being used in terms of the build and development of the site at the moment? Is that where you wanted it to be when you set out your plans, many years ago?
Yeah, I can drop you a note back with the stats on that if you want, John. We have it in our monthly reports. So, so we have a contract review with Balfour Beatty each month, and they report against such indicators that I mentioned. So yeah, on the whole, we're happy. If there's any deviation, it's been because of COVID. But there's a sort of, I think it's towards 70% local sort of employment. But across the Midlands. But let me drop you a note back with that stats for you to circulate to the team. But that's part of our value base. You know, we're employing local people and also giving them the skills to keep practicing. The construction industry in the Midlands is huge at the moment, if you look at all the building schemes. So we're also wanting to be an employer of choice through Balfour to get all the right staff on site. So yeah, it's going well.
Okay, I've got a question from Sophie that she's indicated, but before I deal with staff, are there any just members of the public that want to come in? Doesn't look so right, so over to you.
Yes, please, John.
There are people with their hands up, John.
Sorry, I'm struggling to see hands on my screen.
Sade, friends and neighbours, Dave and Sonia.
Okay, so let's start with Sade then, shall we?
Sade. So my question is kind of.
Can you speak up a little bit, please?
Oh, can you guys hear me now?
Yes.
Faintly.
Yes.
Faintly. Oh.
Go on, we can hear you well enough.
Oh. My question was about, has the building been checked to see if the Wi-Fi that is going to be integrated will be strong enough? Because a lot of the time what happens with newly built hospitals is that because of the material that they're built out of, the Wi-Fi isn't then strong enough, which we're going to rely on for. I'm a pharmacist, I've worked at Sandwell City,
Okay.
I've worked at other hospitals as well. So we rely on it for those services such as the robots for, you know, prescriptions. The doctors are going to rely on it for electronic records. And then as the patient, I'm also sick as our patient, we will rely on it for communication with people outside of the hospital as well. And it's normally like an afterthought, and it's either we don't get any phone signal or it's just Wi-Fi. So is it going to be made free, and has the diagnostics been done to make sure that that infrastructure is going to be there for everyone, staff and patient?
Yeah, so the advantage, Sade, is with the new building, we can get it right, because at the moment we're sort of, it's city, if you work there, you'll know where there's blind spots, because it's just an old Victorian building. So we're confident that we'll have Wi-Fi access throughout the building. We need it for care. So those surveys have been done. Are going to be part of our testing of the building beforehand. It's technically really advanced, the building. So we'll test separate IT systems. I'm not very technical, but then we need to test all of them working at once, and we need to test them at scale. So we'll have to mimic the hospital being full for that. So we'll give it a good thorough test beforehand, but we're confident our plans are robust. So it'll be improved. Come back and work with us.
Is that okay, Sade?
Okay. Yes, that's fine.
Really important question. If we get that wrong, a lot doesn't work. So.
Yeah, and that will
work, I guess. Sonia, I think, had a question.
Oh, hi, Rachel. I don't know whether you can see me or not,
We
because
can.
I can't see everybody else on my screen. I'm on my iPad. I did have just a couple of quick questions.
Yeah.
John there did ask part of my first question. The other bit is, what impact has this new build had on the surrounding areas and businesses? Because that area is so congested at the best of times with a new hospital, and obviously traffic will be increased substantially. So how have you consulted businesses in the area, and what are their feelings? Are they happy about what's happening or not?
Gosh, there's a lot in that, isn't there? So there's one sort of the parking and concerns about congestion. There's sort of how we work now with local businesses, which again are providing the stats from Balfour BT, the opportunities for local businesses. I'm just scribbling these down so I remember. And then there's the going forward, the impact of Midland Met to local businesses. Is that the right way to see your question? Yeah. So working backwards then, there's various ways to have a discussion. I think in terms of opportunities for local businesses that either exist now or don't exist, and we want them to exist. in the hospital itself, there's something called the Winter Garden on the 5th floor. So if you go past, there's a big glass canopy on the front, and the area underneath that is vast. It's a really, I think, unique environment for the public.
No.
So
Somebody's got their microphone on and there's a lot of background.
So within that area, there will be facilities for sort of pop-up businesses to come and work. So businesses that are flexible and agile to come and work in that area. There's retail outlet space in that building, both on the 5th floor and the ground floor. Our commitment as an organisation is to encourage a proportion of that to be locally practiced. Not all the big nationals, etc. So I've got a workshop in April where we're looking at our commercial space use strategy. So we're very clear about the scope of that. And as I say, one of our core values will always remain the local population in this space. So again, we can share that in terms of feedback for our next discussion.
Yeah.
So that's important. So we're scoping that out and defining it and making sure we work to that. And then the outdoor space again can be used. So you've got the big turning circle in the front. It's big enough for a cricket pitch, a festival, or whatever we want to do. So I think we need to be imaginative about how we use that. So, you know, Sandwell Leisure Trust have talked to us about actually, you know, you could have people practice yoga, different things for different people, but I suppose the outdoor space can be used. We're going to have barges on the canal. Even if the canal's not open, we'll put barges on the canal, and we can think about how we can use that space. And our charity is looking to invest money as part of their campaign for Midland and learning pods. So there'll be pods in the gardens for schools, colleges, young people to use. So I think there's all sorts of opportunities to encourage local businesses and people who aren't in business. Is part of the Learning Works piece, and Learning Campus for us must be about, particularly I think with COVID, I'm working from home today. I never worked from home before. I work for 1 day a week, but I think people are far more agile, and how can we use our space to help people practice their business agilely? Because there's some good accommodation there. So I think there's some whole opportunity piece. We won't finish by 2022, and we need to sort of look at maturing that, but I think we should really concentrate on that with the local population. The local businesses now, I'll get the stats back to Ian and John to give you about, because we do track that. And we track that anyway as an organisation, not just for construction, but for what we do, and make sure we are really prompt on local payments, etc., to be a good customer to work with. The parking piece, and I think needs to come into that conversation, that when we talk to local population, we talk to local businesses as well. I know that Birmingham City Council and Sandwell Council are looking at their transport policies and strategy. We've been involved in that. There's a lot of investment that's going to go into cycleways, different modes of transport, and the redesign of the Dudley Road, as far as I understand it in a non-expert way, would hope to improve flow down the Dudley Road. So it's probably worth, if you haven't, looking at the Birmingham City Council website and maybe sort of talking to them about how they can support that in the network plans. But we work closely with both councils in terms of that.
Okay,
so quite a lot
thank
of
you.
questions. Does that start to answer some of that, this topic?
Sorry?
Does that start to answer some of your sort of inquiry?
Yes. I just had another, just very more a point than a question. I'm a public governor for Sandwell, the Mental Health Trust. I'm also a volunteer for a day centre that's actually spitting distance from where this new hospital will be.
Yeah.
I'm very interested to hear what you were saying about open spaces. Most of our seniors are from the BAME community with lots of health issues, etc., etc. So with what you were just saying about, you know, working with organisations in the area, we're a voluntary organisation, a charity, registered charity, so we don't have a lot of funds and stuff. So would places like ours be included in accessing some of that space as well?
Definitely. What we're planning to do with the Director of Comms and I, we're just doing at the moment, well, Ruth's team are doing it for me, effectively drawing a radius around Midland Met, and we're mapping all the voluntary, local, community-based voluntary organisations. Again, a bit like some of the local public, some residents, looking at local voluntary organisations, and then we're going to get a network event going over the summer to look at orientating those organisations to the building in a bit more detail in the space, and then having a conversation about how can you use, what works for you, what are your challenges, can we help you? We won't solve everything all in one go, but let's start, we want the community to own quite a bit of this, so yeah, look out for that, but that's our intention of some work to do. But the answer is yes.
Yeah.
You can use
Thank you, Sonia. That's a great set of questions. We've got 10 minutes left, so that's 3 minutes per question because there's 3 I can see. So I've got Dave, Galaxy about pharmacy, and Fee. So Dave, do you want to go first? And if we can try and do 3 minutes for each question and answer, then we'll get them through.
Okay.
Dave.
Yeah, okay. Hello, Rachel. Can you hear me?
I can. Hi, Dave.
Hi, my name's Dave Bradshaw. I'm the CEO of Sandwell Advocacy. I also sit on the Healthwatch Advisory Board, some of which you've answered really, so just very, very quickly. I'm just kind of interested in the kind of how the environmental impacts of both the build and subsequent operation of the hospital is being considered. And in terms of going forward, in line with kind of clean air strategies and things like that, what commitment the hospital can make towards kind of working towards being carbon neutral, provision of an integrated public transport system, provision for electric vehicles, that kind of thing, and what the commitment is towards generating and use of renewable energy.
Okay. I'm just scribbling all your points down. Thanks, Dave. So one of the programs I head up is the sustainability program for the organisation. We've just actually won the National Health Service Journal Award for environmental sustainability, so we're really proud of that. We got that 2 weeks ago. So in terms of our ambition as a trust, we aim to be net zero carbon by 2030 for all of our sites, which is really ambitious. Midland Met obviously has been designed with that largely in scope. So we're really cited on the environmental impact, and we've got committees at board level that oversee that. Your points about electric vehicles, our new car parks we're building at City and Sandwell have electric charging points, and that facility will be increased very much on our retained land and will be part of Midland Met. We are involved in the electric bike scheme with the councils and advocates of that. And then renewable energy, we're working with Sandwell Council as part of our net zero carbon on a district heating scheme, and certainly I think they see us as quite a sort of driver in terms of wanting to take that forward. So we're working at the second stage of their plans on that. So I think we've got a strong sort of programme to take that forward.
Thank you, Dave and Rachel. Galaxy Pharmacy, Galaxy A70, are they on the call still, or we can read it out? Okay.
I think the lady's here, but maybe she can't.
That's okay. So the question, Rachel, was during lockdown, pharmacy, I assume hospital pharmacy, delivered my medication. I'm just wondering how far is the new pharmacy?
In terms of location?
Yeah. I assume so, yeah.
Okay. I don't know if I'm answering the question, but I don't know if I've understood the question. So in terms of, it's likely our pharmacy model will maintain the pharmacy hub at Sandwell, and that we will have a dedicated inpatient pharmacy at Midland Met. So we'll have our big stock at Sandwell and we'll push it out to Midland Met, travelling the robots to the patients. So that's our sort of pharmacy model going forward. But if there's anything about sort of home deliveries and stuff, I can pick that up outside of this specific question.
Okay. I can't see Galaxy coming back on that, so we'll leave that one there for the moment. And over to you, Sophie.
Yes, thank you. I just wanted to briefly take back to, I'll make it brief, for Rachel's benefit. Healthwatch had been working closely with Oscar Sandwell and people with sickle cell and thalassemia. So we're happy to be part of that engagement process and got quite a lot of information. So I'll send you the contact links and some outline information. I'm particularly interested to ensure that the discharge process is looked at as well, because it's not working as it should as stands. And the other thing was just, I won't, unless you've got time, I wondered about the wayfinding, but I think that the information we've got in our digital project around people's sensory impairments or language barriers, learning disabilities, etc., I think that might be appropriate to share, have some insight in there, and perhaps it links in with that wayfinding process, but certainly I think you'd find that useful, so I'll send that as well.
Thank you. Yeah, definitely. I can see quite a lot of synergies between that piece of work.
Thank you, Sophie. Well, actually, you've been really good with your 3 minutes, three of you, so thank you for that. SV Friends still got their hand up. Is there a final question from you?
Yeah, it's Mandy from Friends and Neighbours.
Mandy, sorry.
Yeah, I would just like to ask Rachel, this model of working with the hospital model, has it been rolled out in anywhere else, and did it work?
In terms, just clarify the question. The model of care.
Yeah, the model of care and how the whole operation works. Has this been rolled out anywhere else, and has it worked?
In terms of one acute site and the treatment centres?
As the one site.
Yeah, so there's a lot of, there's different ways of centralising acute services onto sites. So in terms of the pathways that we're expecting through the Midland Met, there's definitely examples of that. So if you come in with a heart attack and you get senior review and straight into the cath lab, for instance. So the building's designed to build modern healthcare. The building was designed by our clinicians, actually, before we went out to get the architects to design that. So it's got a very original clinical input into the design of the building. Part of what we'll be doing for some pathways and services as we settle into the detail of writing our operational procedures is getting us some peer review to substantiate our plans. So we're working with partners who are sort of best in class or part of our external review bodies as well to get some assurance about that. So it has been done, but
could I also ask, in regards of the parking, maybe you can't answer this question. I know that when I take my dad, he lives in Liverpool, we take him to Fazackley Hospital. They've got a multi-storey car park, and then they've got a little bit of car parking that on a low level. By the time he gets from the multi-storey, if it's busy, he's out of breath, and we've got to keep stopping about 25 times. So in regards to the car parking, the distance between there and wherever they've got to go is really important.
Yeah, okay, thanks for that feedback. We'll take that into account. Really good point.
Thank you very much for that. Well, we're coming up to 12 o'clock, which is when we said we would end. Rachel's been on question time now for a good hour, and I think has answered an awful lot of questions. So, Rachel, on behalf of all of us, can we thank you for coming along today? You've actually made lots of offers to us and to the citizens of Sandwell, which is really, really positive. I know there's some conversations that need following up with Oscar Brothers and parking and residents, and I'm sure that will continue. So on behalf of all of us, we give you a round of applause, Rachel. Thank you very much. Good luck with continuing work at the hospital. And with the transition from COVID to a more normal set of services over the next year or so. Can I thank everyone for being on the conversation and being so open? Healthwatch will be hosting more of these insight events over the year, so look out for them. We do have a mailing list if anyone wants to join that, so they get alerted to those things. And we are always looking for additional volunteers to support the work of Healthwatch, and I'm always open to consider new board members to join the leadership of Healthwatch. So on behalf of everyone, wish you all a very, very happy Easter. Not too many Easter eggs, or at least a little bit of walking to balance them. And we'll see you all again soon. Thanks for your time, and thank you particularly to Rachel Barlow. Bye.